All right, welcome back to the Texas Health Education Service Courage Sessions. We're so excited to bring this resource to you all. Thank you very much for watching today. First off, we'll do some introductions. My name is Enrique Hasso. I am the Associate Director of the Texas Health Education Service. And joining me today in our Courage session is, as always, Dr. Deb Beck.
Good afternoon and welcome. I am the advising coordinator for the Education Service, and more recently, I was the director of the advising office at the University of North Texas for about 18 years. So welcome to our session.
And we're really excited to bring you today Dr. Felix Morales from the Texas Tech University Health Sciences Center, School of Medicine in Lubbock. Dr. Morales, thank you so much for joining us today.
I appreciate it. Thank y'all for having me here today. I really look forward to addressing any questions that they might have.
Thanks. Would you mind sharing a little bit about your role at the school?
Yes. Yeah. So as Enrique was saying, I'm currently the Associate Dean of Admissions for our School of Medicine here at Texas Tech. Basically, I oversee the day-to-day operations of the Office of Admissions. From the processing of applications to interviewing to the selection process. I do a lot of recruiting for our office as well. I'm also really involved in a lot of our own pipeline programs that we've established locally here through our undergraduate campus, but also through our high school programs too. But I also have a dual role. I actually am a associate professor of family and community medicine. So I still have a big practice of patients that I still see, and I'm family medicine trained, so I still see patients from all spectrums of the family life cycle, from beginning to the end of life, and also do deliveries and also work on the hospital service as well.
You are a very busy man. So thank you.
So I still have an open,
so I think one of the big questions that we have for particularly the school in Lubbock is, about the role that the school plays in such the large region. And I think the biggest way that we could explore that right now is the role that the Texas Tech School of Medicine has really played in the COVID-19 outbreak. I believe you might be pretty familiar with what's been going on there. Would you mind kind of sharing with us what's been going on and what role the school has played?
Yeah, I mean, we've really taken a leadership role in this region. This part of the state's called the South Plains. And so when COVID hit Texas and when COVID started spreading into this West Texas region, our University Medical Center, coupled with our Texas Tech School of Medicine Health Sciences Center School of Medicine, really took a great role in regards to establishing protocols for testing. Many of the adjunct faculty were able to open up a COVID testing center that was located just off of the University Medical Center campus. A lot of our faculty who are involved in pulmonology and critical care also took a huge step forward in the leadership in regards to reopening units that were closed down in the hospital, and to be able to take care of the patients, to make sure that if we had a situation with capacity issues, that they were able to be seen and taken care of. I have fellow faculty members in my own department of family medicine that were able to provide lectures and lecture series on PPE and on how COVID is transmitted. And so we can disseminate that information out to the community here as well. Our own chairman of our Department of Family Medicine has become a local hero. He's become the physician for our city who's provided information from what we see here locally and nationally, to be able to broadcast that to the Lubbock and the South Plains region. So very proud of that. I'm very proud of the fact that I'm involved with such a good group of people who have been able to be leaders here locally in our community.
Thanks for that insight. Would you mind kind of walking us through the breadth of the campus? Because I know it's not just the campus in Lubbock, but it's rather spread out throughout the entire Panhandle region.
Yeah, no, we here internally in our office, we call it the state of tech. And so it's a big, we serve a huge area. The catch area for our region essentially is, a few counties just east of Abilene down to the border, all the way down to El Paso. But in regards to the medical school itself, the hub, the central location is in Lubbock, Texas, because that's where the medical school was originally established. But we just celebrated our 50th anniversary last year, and part of the reason that the school was established was one to be able to help the communities of West Texas. So one of the initiatives that was brought upon to our medical schools to make sure we had an extended outreach. So we have regional campuses in the Permian Basin, which is the Odessa Midland area. We also have a regional campus site in Amarillo for our medical school. And so in the sense that when students come onto our campus for their medical school training, everyone does essentially their first 2 years of medical school here. And then for their third and fourth year, for their clinical rotations, they're sent to one of these regional campus sites. And then 4 years ago, we're able to expand that even a little further. So we have actually a great partnership with one of the private hospital systems here in town. And we were able to increase our class size to 180 students, which gave us the ability to send 30 students to Covenant Health System for their clinical rotations as well. So since we have 4 clinical rotation sites for our medical students for their third and their fourth year.
That's fantastic. I'm excited to see that growth, especially as part of the Texas Tech system. We had the new dental school from El Paso join us a couple of weeks ago, and this fall we're excited to welcome the new veterinary school for Texas Tech system. So this is a really exciting time for that system, for some really great growth in terms of reaching out and promoting health professions opportunities for young people in the state.
Yes.
And not so young people in the state, for all you know. Well, I do want to remind everybody that this is a live Q&A. So if you have any questions for Dr. Morales, we're very excited to forward those on to him. We do have a list of questions that we'll refer to as well, but first and foremost, he's here to answer your questions. So if you have any questions, any concerns about going to the school, concerns that may have arisen because of impacts caused by COVID-19, Dr. Morales is here until 2 p.m. to answer your questions. So don't be shy. Post your questions on either the Texas Health Education Service Facebook page or on the TMDSAS page, and we're happy to forward this to him. So on the topic of that specific school, I know you alluded to some of the special programs that you all have. And I'm always so excited to learn more about the high school pipeline programs that you all have, and kind of like on the front end, but also on the other end, you also have the family medical accelerated track.
That's correct.
Family medicine accelerated track. And would you mind kind of walking us through some of these different programs that you all have?
Yeah, so I'll start in the front end. One of the newest programs that I'm very, very excited about is we developed what's called a middle school to medical school initiative here locally. When I assumed this role, when I had the honor of being given this role as being the associate dean, one of the main objectives of mine was to make sure that we're able to build pipelines for our local communities and make sure that we kept the very best students in the future to come back to our medical school and potentially, practice medicine in this West Texas region. And so one of the things that we identified as well as, communities of need, those who are underrepresented in medicine. So we're able to establish a great relationship with one of our public charter schools called Harmony Science Academy that serves the eastern portion of Lubbock, Texas. And we're able to develop a medical school initiative in which we provide them guidance in regards to advising on, for middle school to high school age kids and what classes they need to be looking into in preparation for their undergraduate time, and also potentially as they get into medical school. And we're going to kind of track these students over the next 3 years. And hopefully my ultimate goal is to see one of these students graduate for medical school, hopefully in the not too distant future. And we also have other pipeline programs that are also associated with our partner in the undergraduate campus as well. We have a early acceptance program, an early insurance program through the Honors College, and we've extended that out to other West Texas universities such as West Texas A&M, Angelo State, and we also have a great relationship with Austin College, in which we have an early insurance program through them as well. But on the flip side of things, once you become into medical school, one of the things that we are known about here locally, regionally, and even nationally is our Family Medicine Accelerated Track program. We were the first school in the country to develop a program to graduate medical students in 3 years, in particular those who are interested in primary care, because we see that primary care is a great need, not only locally, but statewide and also nationally. And so students who have a strong interest in primary care, specifically in family medicine, we're able to graduate those students within 3 years, and we provide a tremendous amount of funding for them. So a lot of these students actually graduate with very little to no loan debt. And we're able to actually put them into a residency program that will help serve the needs, not only of that program, but potentially that region if they decide to stay there as well. And we're expanding that program as we speak. You know, traditionally we had only 12 to 15 students, but now we're looking at expanding it up to 18 to 20 students per class. And we're actually looking for partners beyond our residency programs here at Texas Tech. We're looking for partners in the Central Texas region so we can potentially send medical students who graduate from that program into those family medicine residency programs as well.
The great state of tech, indeed.
Yes.
Awesome. Well, thank you for sharing that information. I want to flip this over to Dr. Beck, using her expertise as a former advisor. I'm curious, what's the age of the youngest student you've advised who's interested in going to professional school?
Oh, probably a freshman in high school.
Wow.
As far as I know. Of course, we get families who come in, so and they will visit, and you don't know who you're influencing at the time. Maybe some of the younger ones also. And I have said to those little kids, well, I'll see you in a few years, and when you start preparing for your pre-med program, you know. So you never know who you're influencing. And maybe planting a seed that they too will one day be a doctor or a dentist or a vet, and in the health professions.
Yeah, especially since this journey is so long for so many students. You know, you can't just wake up one day and say, I think I'm going to apply today. You know, there are years and years of preparation that go into, you know, even for some folks, you know, jumping into chemistry 1 for majors would be a huge leap. And so it really is a longitudinal preparation. And so we're excited to work with Dr. Morales using the expertise that they've built from that pipeline program to offer some of those resources to some of the students who may be, you know, watching right now and maybe in high school because they have nothing to do right now since they're on summer break. You know, this is a long journey, and we're glad to see that there's support on all ends.
Enrique, we might say something here also about the early college high school preparation, where some high school students are graduating with an associate's degree at the same time they're graduating high school. So it is very important that they start preparing early in their high school career. And as Dr. Morales said, in junior high school, it's not too early to start there to begin your preparation. And if there's a HOSA program or a internship program in high school, certainly get involved with that.
Yeah, and to kind of jump into this conversation, you know, we have advising for high school students as well, and the youngest person I ever advised was 14 years old. And as Dr. Beck said, I don't know how much advising I was doing to this student, more so probably for the parents. But it is true though. I think if you are interested in career in medicine, it doesn't hurt to start early in the process, as you're transitioning to the 8th grade, 9th grade year, and start creating that roadmap for yourself. I always say it's never too early to start looking at high school curriculum and high school science courses. And I always say try to take those science courses that are the most difficult ones, whether it be a dual credit course or an AP credit course, because ultimately that's what's going to prepare you for your undergraduate career, and then hopefully you can continue that on through medical school as well. Now, when it comes to the dual credit associate's degree, because we know that that's a trend of how many high school students are graduating so much college credit underneath their belt, I would say just make sure that if you're doing that, make sure that you're achieving all A's in those dual credit courses, because ultimately when you apply to medical school, all those courses are going to be counted towards your overall GPA, and you want to make sure that they're aware of that. They're trying to achieve the highest grade possible there.
Very well said. I think that catches so many people off guard when they're filling out their TMDSAS application and realize that one dual credit class is actually counting toward their GPA.
Exactly.
Yeah. And you as a school also, I wanted to talk more about GPAs. You as a school, when you see the application, you can actually tell which semester and which year that was earned. So you can see whether it was a high school dual credit course versus a senior upper division course.
Exactly. Yeah. And the service that the TMDSAS provides for us in regards to breaking that down is tremendous. And so we're able to track even grade trends. We really, I think we're not the only school that probably looks at a transcript with a fine-tooth comb. We're going to go through that pretty extensively, so we're able to kind of figure out, okay, what happened here? Were they just too young? And you can see the maturity as the GPA trends up towards their senior year.
Mm-hmm. All right, we have a question that came in from an advisor, Ms. Anderson at UT Dallas. How's it going? Good to see you. With being fully aware that this could change on a weekly basis, what are the current plans for the interview structures at Texas Tech? Are they going to be virtual or in person?
We have decided to go all virtual, and for the simple fact that with the COVID pandemic still ongoing, we want to make sure that we limit travel for our interviewees, and so we're going to use Zoom as that platform for interviews, and we're going to try to still structure the day as similarly as we can. If it was an in-person interview, we are in the process of developing a virtual tour of our facilities. We're going to have pre-prepared messages from our dean of medical school. We're even going to go as far as having breakout sessions with our financial aid office and our student affairs office as well. But we just felt like as an institution, it would be safer for everyone involved to make sure that we limit travel in and out of Lubbock. And at the same time, where that's a disadvantage to our schools, the fact that we love bringing students onto our campus to sell them on what we are. But we're going to try our very best still to continue outreach with those students as well. Oh, one last thing. Even our timeline for the interviews has changed too. Traditionally, we were starting first Friday of August. Now we're going to push that back to September, sometime probably after Labor Day, and move that down into either the last week of January or the first week of February.
And that corresponds to the delayed application deadline and the pushed back match deadline and match date for TMDSAS as well. So thanks for updating us on that. Hopefully that eases the concerns of a lot of our students who are not sure about which Mcat test date to select, or whether they got the dreaded September 28th test date, which is one of the last ones that's offered. The schools are adjusting to the schedule. This is a unique year, and everybody's aware that there have been effects all over the place in terms of preparation. We have a question from a student. Could you elaborate on the admissions committee view completing a biomedical science master's program when the science undergrad GPA is below a competitive range? So just to give some context to those of you who might not really be following that question, in terms of preparation for medical school, there are some students who opt to, maybe they didn't have all the grades that they needed, they didn't have all the prerequisites, or didn't have the way to prove that they were academically prepared for professional school. A lot of times these are reapplicants or non-traditional students. And so some opt to do post-bac programs that would help them raise their GPA, since those courses are undergraduate courses, and so it helps raise their undergraduate GPA. And other students who may have had more competitive GPA and may have already completed all the prerequisites may opt to take a master's program pathway. Following up on the student's question, could you elaborate on how those two are viewed by the admissions committee?
Well, I would tell you this. The phrase that we like using, and I'm pretty sure a lot of other medical schools, holistic review and application. So holistically, we're going to look at every aspect too. And I would say from our institution, I can only speak on behalf of our medical school, we don't have filters or minimum GPA requirements to have your application looked at or evaluated. Now, I would tell you this, I never like misguiding any student in regards to the importance of metrics and numbers. So if you feel like your science GPA, your overall GPA was a little bit lower, one of the things that we do always advise is look into these graduate medical sciences programs or graduate programs that are more science-based, because often that can tell us as a committee, if we see an applicant holistically and we see things there that stand out and say, yes, this is a student we want to bring on campus, but there could be some potential concerns about their academic readiness. And we look through their transcript, if we look through their application and we do see that they've taken the initiative to go into a graduate medical sciences program, it gives us more reassurance that this kid, or the student, I should say, is serious about becoming a physician. And especially if they're able to perform very well at the graduate level of medical sciences coursework compared to what they did as an undergraduate, because that provides us reassurance that, one, they're becoming, prepared for the rigor that they're going to see as a medical student. And two, especially if they perform very well, for us, it's about that upward grade trend. And we'd rather catch a student coming up versus one that's been having that rocky road through their undergraduate career.
Dr. Morales, doesn't Texas Tech have a 2-year post-bac program?
We do. It's called the Graduate Medical Sciences Program, and we love it to death, partly because the students who, as Enrique was stating with a student who put this question into the question bank, it captures those students. And what it does for them is that it puts them in a situation where they're literally taking courses with the first-year medical students. They're taking the gross anatomy. They're taking the biology, cells, and tissues course. I mean, they're doing these intense courses. And what it does for them, one, it allows them to see that firsthand. They're able to perform. We have a whole year's worth of grades and evaluations from their professors. And then they become TAs for the oncoming group for their second year. And on top of that, we guarantee them an interview with our medical school in Paul L. Foster in El Paso as well. So they have guaranteed interviews with 2 schools at least. And the success of the program is outstanding. I would say at the moment, I want to say they're 97, 98% rate of having students get into medical school at this particular moment. And I can probably count on my head how many haven't gotten in because there's been so few. And eventually those that didn't get in will get in at some point. So it's been very successful for us. We're able to see how they perform, and then they come back and then they retake those courses as first-year medical students again. And oftentimes they're the top of the class. I mean, literally they graduate in the top 20 of our medical school class. And so they're just, they perform very well.
And do they earn a master's degree?
They do earn a master's degree. So they earn a master's degree, a medical science master's degree.
Dr. Beck, in terms of students who may not know what their next path might be, let's say, for example, somebody tried to apply as a junior to professional school and they didn't get in, and and we've done a podcast about this already, about assessing where you need to go next. Could you give us a quick walkthrough on whether those students who may need some additional academic preparation, whether they should choose a post-bac program or a graduate program?
Sure. A lot depends on your situation and your GPA and your Mcat. Some of the post-bac programs that, as Dr. Morales was explaining, do offer a prep course for the Mcat, and some even offer it for the DAT. So that's always a good way to enhance your application. If you haven't, maybe you don't have the confidence to go forward, and that would also build your confidence that you're taking medical school level courses, and it also increases your knowledge base as well. So that's always helpful. There are some programs that are certificate programs. These are usually on the university level, and you can go back and repeat courses or take additional upper level biology and chemistry courses to improve that GPA. And more than that, I think, is to show that you have improved your study skills, or maybe there are extenuating circumstances at home that have been dealt with, or personal circumstances that haven't been good in the past, and you've been able to deal with that. And maybe it's a abusive relationship even, and so that will certainly take your time away from studying and preparing to be a doctor. So, and then there are schools where you can just go back as a non-degree seeking student. There's not a certificate program. You go to the advisor and say, maybe I really messed up my freshman and sophomore years even. Is it too late to go to med school or dental school? And it's usually not too late. It's just extra work that you need to put in to prove that now you're ready, and now you have the mental capacity to dedicate to showing the medical school's admission committee that, oh, I've got this now and I can do it. It may take extra time and extra money, but I never give up on people.
Absolutely. And just as a quick reminder, Dr. Beck and I will be answering your questions directly tomorrow. So there are certain to be several questions about advising, specific scenarios. So we'll be glad to address those tomorrow during our current session. Dr. Morales, we have a couple of follow-up questions to the master's program and to the interview style. So this might be more rapid fire since they're just follow-ups. Do many students from the Masters of Biomedical Sciences program from Texas Tech El Paso often matriculate to the School of Medicine in Lubbock?
So we have so we also have an agreement with Paul L. Foster, or I guess the Health Sciences Center down there, that their version of that program we interview as well. I don't have the number on the top of my head in regards to how many have matriculated from into our medical school, but they are guaranteed an interview. It's hard to say. Honestly, I don't think it's as many as the graduate medical sciences program that we have at the Health Sciences Center, but we do interview them. We keep up with that part of the agreement.
Yeah, and those students probably also get picked up by the Paulo Foster School of Medicine as well.
I would suspect so. I would suspect so.
Yeah. And then we have another question about the virtual interviews going on. How will those affect decision or impact decision making? There's a lot that can be said about in-person interviews. How would they be answered virtually?
Well, you know, at this moment, it's I would say that that every student's going to be at the same, or every applicant is going to be on the same level playing field, meaning that we're not going to bring students onto our campus. We want to make sure everything's the same in regards to the format. How that's going to impact decision making is hard to say at this moment. I would say that many of us have already become kind of adept to using Zoom. And I think for us in particularly, it's going to help us in the sense that we're going to be able to bring more faculty into the fold to be able to interview students. Whereas in years past, it was more difficult to do that with our regional campus site system. So I think you're going to get more quality interviews in regards to the faculty members who are going to be on board for this. How that overall is going to impact the decision making is hard to say. I don't think it's going to impact it as much as it, you know, I guess there's not going to be much change, I should say, in how the decision making ultimately, because we're still going to have our own in-house rubric and how we judge an interview, and that's not going to change.
Yeah, and as we reach the end of the summer, this is actually one of the areas that we're going to be focusing on as the Texas Health Education Service to produce some help for you all in terms of you know, best practices for setting up virtual meetings for your interviews, you know, making sure that you are treating it professionally. You know, you probably don't want to be wearing basketball shorts and
yes,
flip-flops. You know, the standard rules still do apply. Because you want to have that decorum, and I think it really elevates the conversation when you're in the interview setting. And so we will be providing some additional help resources for you all. So thank you very much for raising those questions.
Just to add one more last tidbit to that, you know, since we have actually a regional campus in Abilene that's associated more so with our Masters of Public Health program and our nursing school. So we've had some slight experience because we have a dual degree program for an MD/MPH. And so some faculty from the Abilene campus have interviewed our MPH candidates as well. So what we've seen from that cohort, that it really hasn't changed the evaluation process at all. And so I would predict it's probably not going to change the evaluation process too for our medical students or medical student applicants.
All right, we have a follow-up question to the early college programs discussion from a few minutes ago. For those students who fall in a situation where they were perhaps too young and stumbled upon early college courses, would you prefer to see this addressed in the essay or just try not to bring it up at all?
No, you definitely want to bring it up because we're going to be able to see that through your transcript, you know? So if you, at whatever level, I mean, hopefully it's early on in which you see some of those stumbles because to be quite honest with you, if you stumbled, you know, I always say this, you know, what you learn in 1 year in high school is equivalent to about a semester in college. What you learn in 1 semester in college is equivalent to about 1 to 2 weeks in medical school. So the volume of information comes in fast and furious. And so if you stumbled early on in your college career, meaning that transition into college was difficult, right? Whether it be your first semester, second semester, or even, you know, as a high school student having to deal with, you know, more intense dual credit courses, those stumbles, I would rather see those at the beginning because then you mature as a person, you become more dedicated, you figure things out in regards to how to study, prepare, and we see that upward trend, right? And so, so with the stumbles, like I said, I would say you please disclose those because you want to make sure that, and we have a secondary application in which there literally the question is asked, can you identify any road hurdles or road bumps that you've occurred through your undergraduate coursework? And that's where we would want to see that to be identified. Because if you have a GPA that's not towards the top and it's more, towards the middle, and we can kind of see, okay, this happened early on in this person's life. Or even if there was some sort of, potential family issue, a parent died, a spouse died, something like that occurred, that caused, a decrease in their GPA. We'd like to know that, and that helps that student's cause.
Yeah, and as we've mentioned, there's no hiding in the application.
No.
When you see GPAs that are really, really astronomical, and compare those to the overall trend, let's see if I can get this right, the overall trend of the GPA, and you can tell that you're being boosted by that dual credit, it's very apparent to the schools because of the different ways that the GPA is calculated by TMDSAS. So disclosure is always the best option. You just mentioned the secondary applications, and we have a question on that. Would the Mcat scores be required prior to receiving an invitation to completing the secondary application for Texas Tech?
We're still in the decision-making process of that. What we have decided is that we are going to require an Mcat before we extend an offer. So we made that decision. We're still in the process of deciding whether we're going to require an Mcat for an interview. I would predict that based off the discussions I've had with various committee members, that most likely that's still going to be the case. We're still going to require an MCAT for an interview. Now, to answer the question about the secondary app, I would predict too that that's probably going to be the same. We're probably going to require an MCAT for someone to be able to receive a secondary application. Although I will tell you that that's something that that's still in the discussion. So if there's one point of entry that not having an MCAT might not be impacted, would be that secondary app, but we still have to discuss. We ultimately decided on the MCAT for interview. I think MCAT for the selection. We're still in discussions for the interview part. The secondary app, it hasn't been brought up, quite honestly, but it's something that we're going to have to discuss here in the next committee meeting.
Yeah, and as you mentioned, interviews maybe not starting till later this year. That surely allows for additional time. I know we've gotten some questions on here. I'm taking the MCAT in July. Is that too late? I'm taking the MCAT in August. Is that too late? And so from what you're sharing, I think those students can really rest assured that your school's really, and I've said this to every current session, your school's doing its best to be equitable to all applicants this cycle.
Yeah, this is just a whole different time frame that we're living in. And, in years past, I would say July, August, September, obviously too late for the MCAT if you want to apply for that particular year. But this year's different. This year, I think we're going to realize that there's probably going to be a huger or larger influx of applications later in the application period in years past. So we're anticipating that already. We're preparing ourselves for that.
So as our viewers and listeners also know, the TMDSAS application does not require letters of evaluation, transcripts, or MCAT scores or DAT scores to be received prior to submitting the application. And so your school will receive applications without some of those documents. Would the school begin reviewing applications without an MCAT score?
We have kind of a process in place in which we have our analyst, once she receives the transmitted portion of the application from the TMDS, she has her checklist that she goes through before she's able to invite someone for a secondary application invite. And that also includes letters of recommendation and scores and things like that. Now, that process right now, that's been the traditional process. To be quite honest with you, in last year's and previous year cycles, we required the MCAT, we required letters of recommendation, we required all those types of things before we're able to have that student submit a secondary app. This year is going to be a little bit different. We're still kind of working around that. And part of that is because we also use a software package that helps with the transmission of the applications to our system that makes it a little bit more user-friendly. And we're actually in discussions with them to kind of change a few things around to help us with the processing of the application. So to answer your question, at this particular moment, I don't have a definitive answer on regards to reviewing of the application. I would think we're probably gonna have that decision made probably within the next couple of weeks. I would predict that we're probably going to start looking at applications, but we definitely probably need a secondary app of some sort before we are able to kind of completely look at the application.
Thank you. And we definitely understand how some decisions are still being made. Again, this is a different year.
Yes.
Yeah. So what kind of opportunities should students be engaging in to supplement any or to fill in for any missing experiences from the summer due to COVID-19? Have you seen some examples of that, or have any advice to share on that front?
Yeah, and it's difficult because, when it comes to healthcare experiences and particularly shadowing, that's always a kind of a rate limiting step depending on where you're living at, right? And I know a lot of our undergraduate students here at Texas Tech, struggle a little bit with that. So we've developed programs for them here locally through our Health Sciences Center now. With COVID, there's a hesitancy to bring a student volunteer into a clinic or into a shadowing experience because we, for safety purposes, we don't want that student to be exposed. I'm a big fan of scribing. I know often when we talk to other medical schools, sometimes there's an internal debate, scribing, shadowing, and vice versa, right? And our stance here, it is a form of healthcare experience. It is a form of a shadowing experience because you're literally working hand in hand with that scribing or that physician. So what we've been advising is, if you have the time to maybe get a scribing service type of work. Now, granted, you're still potentially exposing yourself to COVID if you do that. So we want to make sure that you're cautious about that and aware that there are risks involved. So we're not necessarily advocating every student do that, but that might be another way to kind of overcome the challenge that COVID has presented in regards to shadowing. There are some clinics that I've heard about that will allow students to maybe interact and shadow physicians in this kind of virtual format, the telehealth and telemedicine program. We're not allowing it in our personal clinic here at Texas Tech, but there might be another way of doing it as well.
So virtual experiences like that, you believe would be sufficient?
I think so. I've kind of labeled this year as the COVID class of 2020, and we know in our institution, we know that that there's going to be limitations, right? And we know that there's going to be some certain areas of the application that aren't going to be as robust as previous years, So what I've been telling a lot of students through advising sessions that they've called into here in our school is to document that, make sure you're clearly stating, hey, because of COVID, it's a unique experience because of COVID. I wasn't able to do as much of the shadowing that I have, but these are the reasons I still want to become a physician. And these are the reasons why I think I would make an excellent, provider. So, being able to document that, I'd really highly recommend that for sure.
Yeah. I think the most important thing right now is not to be idle in waiting for opportunities. You're going to have to go out and find them. So for those students maybe that aren't applying this cycle, what advice would you offer?
In general, or just in regards to the shadowing?
Let's start in general, and then perhaps in regards to having this at least one semester or two now being affected by COVID.
I would say just in general, with any student, you still want to be able to create some roadmap, some ability to navigate your way through the ultimate goal, which is being accepted to medical school, right? And so with the challenges involved with COVID, reach out to your pre-professional health advisors in your respective campuses to determine, hey, which courses are going to be affected the most in regards to credit, non-credit, pass, fail type of situation, right? I would still encourage you, although we're going to be as student-friendly as possible. So if we see a credit or a pass on a prerequisite for this cycle, we're not going to turn that student away. But if you have the ability to take a course for a categorical grade, a numerical grade, I would still encourage you to try to use that option to help us assess you better in regards to your readiness for medical school. Also, too, beyond just the struggles involving, shadowing, there are a lot of virtual format community service projects that you can look up and kind of get involved with as well. So there's things that you could do from that standpoint, but beyond that, if it truly is your desire to be a physician, if it is truly your desire to have an MD behind your last name, you definitely want to make sure that you're being creative, that you're being engaged, even if it's through a virtual format, even if it's through an electronic type of format. Make sure that you're still being involved. I'm sure there's a lot of community service projects that would welcome help in regards to being able to help them out virtually. So I would say just try to be creative and involved as much as you can.
I'm going to put that on a t-shirt. That's a solid code. Just be involved as you can, because ultimately, when we're talking about, the broader philosophy of admissions, you have the core competencies that the schools, that the medical schools abide by and use as a template to inform their own admissions practices, as well as, your own school's mission and value statements, how all that comes into play in the admissions process. It all comes down to how engaged you are with using your skills in the sciences to help other people.
Yes.
Yeah. So excellent points. Let's see. We have a few minutes left in this session. So if you all have any other questions that we'd like to address, please do post them in the chat box on either the TMDSAS or the Texas Health Education Service page. We do have time for a few more questions, and I'm going to take advantage of that and ask a question that I had prepared. As a physician yourself, seeing the situation right now with COVID-19, what kind of permanent changes do you foresee for the profession?
Yeah, I see a couple of things. I'm a primary care physician, and so what I think one of the permanent changes I think that's occurring is the telemedicine, the telehealth outreach to patients. I don't think that's ever going to go away after COVID. I think that is going to be the new norm. And so the way we've been able to structure those visits, and particularly are for the most vulnerable, populations in our community, to keep them away from, the hot zone of coming into our medical school campus. So I don't foresee that going away at all. And so I think that's going to be something that's going to be a structural change kind of moving forward. I even seen it, believe it or not, in the hospital setting where, patients who were COVID positive, and to limit exposure to those patients, tablets were given to the patient in the room, and we were having to assess patients through that tablet and ask questions. And so that's something that's also, I don't think that's going to go away too. I think also just the safe practices of, not that it wasn't lax, but just, the proper distancing of sick patients, the hand washing, the wearing of, the PPE, all that for sure. It was there, but it's definitely going to be more enhanced and more structured and more stricter guidelines on how we go about patient and patient care activities. And also too, just, I know that there's been a lot of discussions recently on vaccines and things of that sort. And I'm hoping that this has opened up the community to realize that vaccines are very important, and that they're safe and they're life-saving measures and preventive measures, I should say. And I hope that kind of changes the narrative in regards to getting vaccinated and making sure you're up to date with that too.
Excellent points all around. I think, one of the biggest impacts that we might see longitudinally is that telemedicine, rather.
Yeah, I think Yeah.
Yeah, I'm sorry, go ahead.
I was gonna say, I think first and foremost, I think that is the major structural change that I see is not going to change post-COVID.
Yeah, and I know that there have been several studies done with. I know one of the studies that influenced the decision on finalizing those core competencies was on the interpersonal skills of a physician and the correlation it has with malpractice suits and other other issues that physician may have had professionally. And so I'm interested to see, you know, with telemedicine coming into play, what kind of new skills aspiring physicians may need to develop in order to be able to engage with their patients virtually. And I know we're just addressing those right now with, you know, the online interviews and virtual interviews. And so it'll be interesting to see how that develops over time. You know, because this is definitely a brand new skill set, and a lot of physicians, I know my own physician has struggled a little bit, but she made it through.
Yeah.
But surely this is a brand new skill set, and I think we may have to look back at some of the preparation that students face, knowing that that's ahead of them.
Yeah, you know, and truthfully, going through a virtual format for an interview is good preparation for that in the future, you know, because you know, I always state, you know, I use myself as an example. I'm an introvert by nature that's adapted to the extroverted world of medicine. And so for those who are introverted and, you know, we're never going to say no to a person who's quiet or shy, but being able to communicate, being able to discuss topics, it's going to be very critical, and particularly in this virtual format. And that's just going to carry on into their training, into their future medical careers, regardless of whatever specialty you get into.
Right. Well, we have a time for just a couple of more questions, and I know we have had a few come in. First off, are there any nutrition classes offered at the medical school curriculum?
Well, there are nutritional classes. Now, medical school curriculum is a little bit different. It's more system based, right? So, but they do interject nutritional classes or classwork into that within the first couple of years, and more specifically in your clinical rotations for sure.
And then we had another follow-up question in terms of your crystal ball into the future of medicine. Do you think it may influence insurance policies as well?
It has to.
Yeah,
I hope so. Yeah, I mean, yeah, it has to. That's always the big elephant in the room with medicine, right? And healthcare. No, it has to, just because I've been surprised that some insurance companies particularly do offer some funding for virtual visits, but it's going to have to influence payment structure and everything else. And so there's going to have to be some legislation involved in regards to how that's going to impact us in the future.
And we have another follow-up question to secondaries. Many people say it's best to submit secondaries a week or two after receiving them. I think that's some pretty solid advice all around there. With an Mcat retake coming up, it would be difficult to fill out a secondary while studying. What's your advice?
I would say, well, that's a great point. And so what we've done to be able to help students out with that is that we personally posted our questions for our secondary application. They've been there and have been updated as of April. And so if you have some time to kind of work on one question at a time, I would kind of encourage you to do that. Because you don't want to delay your submission of that secondary if you can avoid it. Because time and time again, when we go back through advising sessions post, match, post, waitlist season, and we look back, and it always seems to be inevitably that the one applied late in the cycle overall, or two, they delayed their entry for their secondary app. So to be as student friendly as possible, we have our questions listed, and so working on one question at a time, that's what I recommend. Just kind of slowly working on it. Obviously, being focused on your Mcat studies, but it wouldn't hurt when you take a small break. Hey, let me just work on this one question.
Right, thank you for that. And If you have any last minute questions, we are kind of winding down here. We have a few minutes left with Dr. Morales. Before we get into your students' questions, I did want to have a quick minute to discuss the use of deferred admissions for students on your wait list this cycle. Could you walk us through what that scenario is and maybe offer some advice to students who are applying this cycle?
So first and foremost, what we've decided as a school is, we know we can't predict, but we are predicting that we're probably not going to have the larger number of students that we normally would have in regards to any application cycle or interview cycle coming into our campus. We're not going to let them come on. And so with that being said, what we decided to do as a school is we looked at our current wait list, and these are students that we've come onto our campus, that we've vetted, that we've gone through the whole process, that we want to come here, but unfortunately there were some space limitations. So what we decided to do is offer what's called a deferred offer to certain students on our wait list. So they're basically going to start in August of 2021. Now, does that not mean that we're not going to have we still have a tremendous amount of capacity in our class, and we just limited it to a small number, partly because we're a little fearful that we're not going to get the amount of applications that we normally have been getting year per year. So when it comes to the students currently applying for this upcoming cycle, I would recommend not to worry about not having that availability to apply, or you're not going to be seeing that because there's an offer. No, we're going to have the ability to screen and to interview and do all that, because we still have a tremendous amount of space and capacity available for those students applying this year.
Thank you for that info. And I think it'll ease a lot of students' concerns knowing that these are applicants that were very high on your wait list.
Yes.
So you're not plucking warm bodies out of obscurity to try.
Oh, no. These were students, like I said, that just because of how, and I would tell you this, we're very proud of the fact that our match was probably the best that we've ever had, which means that, we're doing something good as an office of admissions in regards to recruiting and retaining and doing all that. Mm-hmm. So the students that we've offered these deferred offers to just missed the cut. And we know that these students want to be with us. We want them to be with us. And so we decided to make them a deferred offer for entry year 2021.
Yeah. And as you mentioned, it's a very small portion.
Small number.
Great. We have one more question from a student, and then this is how does a medical school offer financial counseling to help students pay for medical education?
It's a great question. And so I like to maybe answer this first by just spotlighting that we are the most affordable in-state tuition across the country, according to U.S. News and World Report, and also number one actually for out-of-state tuition too. So very, very proud of that fact. And so we do offer an affordable medical school education. Now, what we do is a couple of things. One, once the student gets accepted, they, in the spring after their acceptance, we sent them out a scholarship letter, or scholarship application. And every student who has applied in the last 2 years for a scholarship has received some form of a scholarship fund, I'm very proud of that. Now, beyond that, our financial aid office here will also reach out to the student to offer them other financial aid incentives, whether it be loans and grants and things like that the student will qualify. Now, in order for that process to occur, they have to fill out the FAFSA, and our financial aid office is really great in regards to sitting down with them and saying, hey, this is the total cost of tuition plus cost of living, and this is how much you're going to get in your package, and this is how much you're going to be able to use to live off of as well. So, it's a really great situation where we're able to provide a structured format for how students are able to manage the medical school costs that they're going to incur during their time for the 4 years that they're in medical school.
Not to mention the cost of living in Lubbock.
It's very cheap. and You know, and I would say this, you know, we're 10% below the national average. And there are some cities in Texas, which I will not name, that are 10% above the national average. And so if you do the math, we're 20% below some cities in Texas. And so you save a lot of money because of that. And it's one of the selling points that we like to give to students. You get a quality education for the price, and you live in a safe city and any of the regional campus sites. And even south of us in regards to the Midland-Odessa area, well, you know, it's a little bit further away, but we do provide funding for those students as well to help with any sort of cost of living adjustments that they have to make while they're there.
Yeah, and you know, notwithstanding the great community, the friendliness of the folks up in Lubbock is just don't tell anybody else, but it's pretty unparalleled. When you think about Texas and you have that preconceived notion of friendly folks, it's definitely folks up in Lubbock.
Yeah, you know, it's hard when someone flies into Lubbock and all they see are cornfields for miles, right? And you're like, oh, where's the city? Right. And you land in the airport and it's like you're still in the middle of a cornfield. Like, where's the city? But no, we are a city. We are a city of 250,000 people, and the surrounding communities makes us up above 300,000. We have all the amenities of a big city, but in a small town setting. We don't have the multiples of restaurants and shopping like other cities do, but we have one of everything for sure.
Yeah, you have your Texas Roadhouse and Dave and Buster, so you're good to go. All right, we have 2 more questions that I wanted to take here. This one is in regards to the secondary application invitations. There are some students who are retesting, and so they're asking if they currently have released their existing Mcat score and are waiting on a pending score, would they go ahead and receive secondary application invites?
Yeah. I'm sorry, Enrique. Yeah, so they would have that checklist of things that our analysts will look for. If there's an Mcat in the system, they would receive an invite.
Yeah, and then a second question, this might also be another rapid fire. I'm currently interviewing for master's programs and they've been online due to COVID. I'm sure you could reach out to admissions at the specific schools to inquire about, let's see, oops, I missed the thread. I believe they're asking about schools that moved courses online due to COVID. And on our newsroom, we do have that all of the TMDSAS participating institutions have agreed to accept courses that have moved to an online format due to COVID-19. So that's all covered. And so, this is a courage session. And so we wanted to offer you the platform to address all of our applicants right now. Any concerns or any words of wisdom that you might be able to share with them?
Yes, so there again, I appreciate the opportunity to be able to do this. This has been a lot of fun. And I would say that under this COVID situation, please don't be afraid. Have the courage to be able to navigate whatever challenges you might have, either locally or even through your own university. No dream is not catchable if you're able to at least set a goal for yourself, if you're able to create a roadmap, and if you're able to put the tunnel vision blinders on to say, yes, I one day will want to become a physician. And I remember in my darkest days of taking organic chemistry, I would remind myself every single day, Felix Morales, MD, Felix Morales, MD, because that was my ultimate goal. And so whatever challenges are pressed upon you from COVID to the credit, non-credit, from pass fail, make sure that if it is you and you're truly your heart and your passion, your desire to become a physician, these challenges can be overcome. All that's required is simply grit, passion, perseverance, and just like I said, good old-fashioned placing blinders on to make sure that you have the mindset that you're going to overcome this.
That's some excellent advice. Thank you. Dr. Morales, thank you so much once again for joining us. You've given us a lot to consider, and hopefully the students who ask questions feel that their concerns have been addressed. I did want to do a quick pitch. Tomorrow, Dr. Beck and I will be doing a health education service current session on our own, where we can address any and all of your questions that you may have. Just a quick reminder, Dr. Beck is amazing and has some excellent experience as an advisor. So if you have any questions about advising, bring those back tomorrow at 1 p.m. And I'm also excited to announce that TMDSAS will also be hosting their own, what they'll be calling TMDSAS office hours next Tuesday. And so they'll be answering your questions about the application itself next Tuesday. So keep an eye out for more information on that. And on behalf of everybody at the Texas Health Education Service and of course TMDSAS and the Texas Tech University Health Science Center School of Medicine, we'd like to wish all of our applicants all the best of luck. Be safe and stay hungry for this. It's going to be worth it. Thank you.